Hey everybody. Well, I'm back from Tanzania. Boy, I don't know where to start. I not only became more confident that the money that we're raising is being used just the best way it possibly can, but I saw firsthand just how much our help is really needed. Now, by looking at this map, you could see that by supporting the activities of KCCO and the One World Sight Project, we can directly affect the eye care and the health care of millions throughout Africa. All those yellow dots represent people who have been trained by the people at KCCO in Tanzania. As a matter of fact, when I was there, I operated and saw patients with a Rwandan ophthalmologist who was being trained at KCCO and will soon return to his country. I can't tell you how effective the money that we're raising is being used. I came across a tumor patient, a person with an eyelid tumor, and she wasn't even there for the eyelid. She was nursing. She had just given birth to a baby. You also see a blind school that I visited, and the school children there are being coordinated partially with people from the organization KCCO. You'll see people from the clinic being lined up waiting for a clinic that one morning we saw 140 patients, and they were all lining up in the morning. They screened, they know the outreach clinic would be there, and otherwise they wouldn't have any way of getting any kind of care at all because they couldn't afford to get to the hospital. We went along one morning, and myself and a Rwandan ophthalmologist screened 140 patients in one morning. And you see a picture here of the people waiting in line until we saw all of them. There's a dire need for some funds immediately, and I wanted to ask any of you who found it in your heart, please donate online and call us. Now, the next video, you're going to be hearing from Jack, my new Maasai friend, who's personally killed a lion single-handedly when he was 17 years old and again at 22 years old. But that's just a little taste of next time. But here I'll let Jamie take it away. So thank you very much, and thanks for giving.
So, what does eye care look like in the more remote parts of Tanzania? What are the challenges? And what has the One World Sight Project done to help? We talked to Dr. Susan Llewellyn, who is one of the co-directors for the Kilimanjaro Center for Community Ophthalmology, or KCCO. As you may know, KCCO is one of the places One World Sight has contributed support, helping fund the construction of a pediatric ward and funding an outreach in the city of Mwanza.
The difficulty with children with cataract is that they don't get in early enough. And you know, if you don't get in early to get cataract done, you end up with so-called lazy eye.
Okay, so what do we do? Well, let's start with the first step, screening. After all, before you can treat a problem, one must know it exists. Now, what exactly is cataract? Well, cataract is a clouding of the natural lens of the eye. Luckily, pediatric cataract may be a large problem, but it's one with a relatively simple and, thanks to your contribution, more available solution. The surgeon can merely remove the clouded lens and replace it with an artificial lens, and in around 15 to 30 minutes, your patient is ready to go. But they can only be ready to go with your help. Hi, I'm Jamie Brown, and I'm the technical director for the One World Sight Project. And normally I include in some more lighthearted clips to balance out our more serious fare. But today I'd like to be a bit more serious myself. The One World Sight Project needs your help to continue its mission to incurable blindness. And we rely entirely on donations from people just like you. Now you're probably wondering, what is it that my donations can do? What is it that they can accomplish? For $2,000 to $5,000, you can pay for an outreach to hundreds of men, women, and children so that they can be screened and treated for cataract surgery. $500 can provide supplies for dozens and dozens of sight-restoring surgeries. And as little as $50 can restore the sight of one individual permanently. You've probably received our video blogs, and you've probably received our emails, and I'm sure you've thought to yourself, one of these days I've really got to contribute. Why don't you make today one of those days? Please know that your contribution is greatly appreciated. Help those who are less fortunate by giving a gift that never gets old and never gets